Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Your skin may say a lot about you, but it may also say a lot about your health. On today's show, we're going to be discussing some common and not so common skin conditions and offer great advice for how to take great care of your skin. All this and more on today's episode of Ask the Doc, No Appointment Needed. Hello, and welcome to another episode of Ask the Doc, No Appointment Needed, where we answer your medical questions. I'm Dr. Yuval Bibi. I'm a board-certified dermatologist and the best-selling author of skincare books. And in today's episode, we'll address your skin questions. Now, let's get right to your questions. Okay, and this one is from Alex. Hi, Dr. B. I'm concerned. Out of the blue, I get rashes and my face breaks out. I've been to the dermatologist, and he says there's nothing wrong, and it could be stress-related. Is that possible? Well, Alex, I'm really glad you brought that up. And stress can definitely be a factor in many skin conditions. Well, Alex, I'm really glad you asked the question about stress affecting the condition of the skin. Stress can definitely be a factor in many skin conditions and the flaring of many skin conditions, meaning the worsening of those conditions. And some of those conditions include rosacea, which we will address on today's episode. Atopic dermatitis or eczema can also flare up with stress, psoriasis, and a number of other conditions. So taking great care of your general well-being is advisable when you suffer from general skin conditions and some specific ones as well. So that would definitely be a factor that could contribute to the worsening of your skin condition. And let's go on to the next question now. So this one is from Rich. My face has been getting red often and flushed. My primary care doctor says this may be rosacea and is sending me to the dermatologist. Can you tell me more about rosacea? How serious is it? And does it get worse over time? Now, Rich, I'm really glad you asked me about rosacea. It is a very common skin condition, and I'm happy to answer in more detail. Now, rosacea, a few things about it is that it is a very common skin condition, more common than most realize. And what it does is it causes flushing or turning red of the face with long-term redness as well of the face, especially of the cheeks and the central face. It may also cause enlarged blood vessels, meaning what we call broken blood vessels on the cheeks and on the central face, on the nose, for example, and sometimes small pus-filled bumps or pimples on the face, what we call acne rosacea. Rosacea can also be mistaken for acne. Dermatitis and other skin problems like seborrheic dermatitis can sometimes be mistaken for rosacea and overlap with rosacea. Now, there are some very common symptoms and findings in rosacea. The facial redness that we discussed and the flushing, which means the turning red or the blushing of the face, which can be a very whimsical phenomenon. It can just turn on a dime or with various triggers that can affect rosacea, like emotional upset, sun exposure, in some cases, spicy foods or hot beverages, changes in the weather or the temperature, and many other triggers. And that changes from one person to the next. Now, there are visible veins or very small blood vessels on the face, central cheeks and whatnot, and the nose. Then we can get the bumps, which are the pimples of rosacea, or what we call acne rosacea. The rosacea patients often suffer from a persistent sensation on the face, such as burning or tightness, sometimes itch. But there's definitely something up with the skin, as it is hypersensitive in patients with rosacea, and that can lead to those persistent neurosensory symptoms of the face. Now, there are some eye problems and what we call ocular rosacea. That is very commonly associated with rosacea and requires a referral to ophthalmology, to our colleagues at the eye doctors, to our colleagues in the eye medicine, to investigate and evaluate that condition and treat accordingly. And then in some cases, rosacea can lead to a condition called rhinophyma, which is a bulbous or potato nose or the enlarged nose. And that can be in chronic cases of rosacea that have been going on for many decades, specifically in men, but sometimes in women as well. So rosacea is, I wouldn't say it's life-threatening, but it is certainly a serious condition, as it can be very disruptive to people's quality of life and the way they see themselves, their self-image. So it is a very, very annoying problem for many people, and it can be controlled with the right set of medications and great skincare. And we are going to get into that later in the show. I hope that I've answered that question. Thank you very much for submitting. So the next one is from Regina. I work in a kitchen, and the heat and grease really cause issues with my skin. I scrub when I get home, but it doesn't help. What can you recommend for me to do to help my skin and, more importantly, my face? Well, Regina, I'm very glad that you submitted this question. This is a very common question that I get in my practice day to day and from people online. And the short answer is that scrubbing is actually something that is deeply damaging to skin, and I'll explain how. And when you have sensitive skin, which it sounds like that's what you have, you're actually causing even further damage and preventing your skin from being able to reset and go back to normal. Now, how does scrubbing work? Scrubbing is a categorical term for a set of practices that physically abrade the skin, whether it's the face or other areas of the skin. And by physically abrading the surface of the skin, we are actually undermining the skin barrier. We're undermining the invisible layers on top of the skin that we take for granted many times, that are helping keep helping keep the skin together and helping the skin stay intact and carry out its various jobs, various roles, various functions. Now, when you have sensitive skin, the skin barrier or those invisible upper layers are actually compromised. They're not doing as well. They are weak. And when you go on scrubbing your skin, you're actually making the problem worse. Unwittingly, I realize a lot of people think that there is a benefit to scrubbing and getting rid of those dead skin cells, if you will, and other elements of the upper skin layers that were vilified by many skincare corporations to sell their product to unsuspecting customers. But I want you to know that there's really no need to scrub the skin or to cleanse the skin for that matter, especially on the face. All those practices would actually undermine the skin barrier, and you're better off not doing those, but rather washing your face with lukewarm water. If you have any makeup on, I would remove the makeup very gently with coconut oil or maybe petroleum jelly on a cotton ball, not to abrade the skin, not to undermine the skin barrier any further. And all those are going to help you calm your skin down, calm the face down, so it's not going to be as sensitive. Well, I really appreciate the question. Now, the next one is coming from Tatiana. I'm a busy businesswoman, and I have to deal with rosacea. Okay, well, my question has to do with makeup removal at the end of a busy day. What's the best way to remove makeup without causing a flare-up? And Tatiana, thank you very much for your question. That is a very common question that I get asked, and I answered a little bit in the last answer to Regina, but I want to address removal of makeup in more detail. So most women remove makeup in ways that are highly abrasive to the skin, and they use products that are water-based, which means that they have to contain emulsifiers, and those emulsifiers are basically detergents. They emulsify, or they cause a combination of the water content and the oil content on the skin to be able to remove it more easily. And that can seriously undermine and damage the skin barrier. That's like using soap or cleansers on your skin, which a lot of people use, I realize. In fact, most people do. But when you have sensitive skin, that is a highly damaging factors, or that highly damaging set of practices And if you have sensitive skin, meaning your skin barrier and the upper skin layers are weak already, your skin may not be able to tolerate what most people can tolerate on their skin on a regular basis, which is the use of soaps, the use of cleansers, and the use of makeup removers. Specific examples of makeup removers that most women use are micellar water. That's a very popular category of products that are sold to the public as very gentle and non-abrasive, but they are in fact abrasive. They may not be as strong as soaps or other cleansers that you're using, but they're certainly abrasive. And then makeup wipes that are also usually infused with detergents. And then there is the old school way of removing makeup, which is to use soap or cleansers on the face. All these methods are highly abrasive to the skin barrier. So what I recommend is I recommended to Regina is actually use an oil-based approach. And the oil-based approach is to apply coconut oil or petroleum jelly on a cotton ball or on your index and middle finger to your face and wipe the makeup off with the cotton ball or the two fingers. Wipe it off repeatedly until you have completely removed the makeup from your face, and then allow the residual product, which you've been using, the coconut oil or the petroleum jelly, to stay on the face as a protective layer, as an occlusive layer on the skin to help the skin barrier catch up, replenish itself, and recreate itself to the full extent. I hope that answers your question. Thank you very much for asking. So the next one is from Carla. Okay, Carla, hello. Hi, Dr. B. Years ago when I was a teenager, girls actually put baby oil on our skin to help us get a better sunburn. Yes, don't I know it? Now, today, I find myself telling my daughter and grandkids to make sure they put on sunscreen. Can you talk about the importance of putting on sunscreen? And more importantly, which sunblock is suggested for kids and adults? So, Carla, thank you very much for your question. Yep, so the baby oil era of days gone by is something that I run into very frequently at the office. People come in and tell me that they used to apply baby oil on their skin to get a better tan or maybe even a better burn, as you described it. That fell out of favor in past few decades with the movement that started popularizing the use of sunblock. And sunblock does have a very important role in preventing sun damage on the skin, specifically sunburn. And that is very important in people who are fair-skinned and tend to burn or tan easily. And those people, we want to avoid very significant sun damage over a long period of time because it does lead to skin changes that are not very aesthetic, and they can actually look older, and that leads to skin aging. And then there is the increased risk of skin cancer. That is somewhat controversial. That being said, sunblock is thought to prevent certain types of skin cancer under certain circumstances. And then again, there's the aesthetic element. So what type of sunblock can you use and when do you use it? Well, I would use it when you expect to go out in the sun and you think you're going to get deeply tanned or burned. I think that calls for use of sunblock on the areas that are exposed if you cannot afford to cover them in any other way and protect them from the sun in any other way, meaning physically, by using clothes, or get under the shade in some way, or get out of the sun altogether. So what do you use for sunblock? Well, sunblock ingredients are farther. There are many sunblock ingredients out there to use. In recent years, the ingredients called organic sunblock ingredients have fallen somewhat out of favor for various reasons, and they are being slowly but surely phased out of products. So the most common and popular ingredients nowadays that are considered generally safe and effective are zinc oxide and titanium dioxide. And those products are very common. There's many products that contain those two ingredients. Those are considered very effective sunblock factors or sunblock molecules. And they basically screen out most of the harmful rays when we apply them to the skin. There is a trick to it, though. You do need to watch the amount. You do need to apply it pretty thickly to get the effect, the desired effect of sun protection. And you also need to reapply it when you're out in the sun and being active, because the products do wear off and the products do wash out and are eroded over time by spending just time out in the sun, sweating, living your life. So the efficacy of the product does diminish with time. Now, about kids specifically, I like recommending for the kids, or for the parents rather, to use products that contain zinc oxide for their kids. I always tell them to find the products that have the least amount of ingredients in them, whether it's a 2-ingredient or 3-ingredient, or maybe 4-ingredient product that contains the least amount of ingredients. You don't want any shenanigans or any nonsensical ingredients on your child's skin, and you want to use the bare minimum so that you don't add any extra ingredients to the child's skin, which can potentially lead to irritation of the skin and other problems. So my approach is to use the least amount of ingredients containing products on the skin, and to recommend those to the parents to use on their children as needed for sun exposure. I hope that answers your question, and let's move on to the next one. Next one is from Rose. Hi, Rose. I'm a senior citizen, and lately I'm seeing these random bumps and marks appearing on my skin. You talked earlier about cancer. I sure did. But can you tell me about the different bumps I'm noticing on my body, and which ones I need to be more concerned about? Rose, that's a great question. I love it. I love it. So there are things to notice for when looking for skin cancer, or let's just make it a little bit broader. We're looking for things that stand out from other lesions or other bumps or spots on the skin. We're looking at something called the A, B, C, Ds, and E's, which is an acronym that stands for a few things to pay attention to. The first one is asymmetry. Anything that's not symmetrical, not nice and round, or maybe oval shaped. Those things that stand out in their shape need to be paid more attention to and possibly brought to the dermatologist for additional evaluation. We're looking at the border, which is B. Borders need to be nice and sharp, not jagged, not fuzzy. They need to look nice and crisp. And the circular border is the most desired border, and something that we tend to look at as benign. If anything has a jagged border or a fuzzy border, that would merit a visit to the dermatologist to have the lesion evaluated. C stands for color. And we like lesions or spots or bumps that are evenly colored, symmetrically colored. So either evenly colored throughout the entire lesion, one color like brown or tan or ochre, or maybe sometimes red. And it depends on the lesion, but we want the color or the pigment to be symmetrically distributed throughout the lesion. When lesions are not symmetrically colored or not evenly colored, that would be another sign for us to maybe turn this over to the dermatologist for evaluation, make sure that everything is fine. D stands for diameter, and anything that usually grows rather than appears, but we also look at things that appear larger than the size of a pencil eraser, which is 5 millimeters or 6 millimeters. Lesions that are larger than that would also possibly merit a visit to the dermatologist for evaluation. And E, which was added later on after the ABCDs formed, stands for evolution or evolving. And anything that's evolving is on the go. Anything that seems to be growing or changing in other ways, such as the shape or the color or the symmetry of the lesion, these things merit another evaluation, another set of eyes, if you will, often by dermatologists, to make sure that you're dealing with a skin lesion that's copacetic, that's actually benign, not suspicious. And if it is suspicious, it might require additional workup, additional investigation by the dermatologist. Now, I do want to address two types of skin lesions that are not melanomas, because the ABCDs do actually refer to usually melanocytic lesions rather than just the general category of skin cancers and other suspicious lesions. So the ABCDs were formed to address melanocytic lesions or moles that can evolve into melanomas, and melanomas can sometimes appear out on their own. Now, there are other types of skin cancer, and they're much more common than melanomas are, specifically basal cell carcinomas and squamous cell carcinomas. And those two usually do not appear as colored lesions, meaning they don't really have much of a color to them, or they can have a color, but that's not the main feature. Those two usually appear as either pimples that don't go away after more than 2 or 3 weeks. They just stick around. and they persist on the skin, or they can appear as sores, as areas that are ulcerated. They have crusts or are bleeding frequently on the skin. And again, any area on the skin that is either a pimple or a sore that keeps on crusting up, keeps on bleeding without any clear explanation, even though you may have weaved a story, or you may have woven a story in your head about how this thing keeps on getting bumped against things and keeps on bleeding for whatever reason you think is causing this. If something does keep on bleeding on the skin and keeps on crusting up, and it's been doing it for more than a few weeks, my strong suggestion for you is to go over to the dermatologist's office to have this thing evaluated and make sure it is not another type of skin cancer. And these, as I said, are far more common than melanomas. Many people have them, and the usual stories that they turn up at the dermatologist's office with a story of a lesion that's been going on and persisting for many months or sometimes even many years. And often it is very late in the game and very late stage lesion that could have been detected much earlier had the diagnosis not been delayed. So I hope that answers your question and made a little bit more sense of what to look for. And if you have any other question, please come and see me at the office. Let's move on to the next question. Next one is from Phyllis. Hi, Phyllis. I'm 76 years old and I have diabetes and also diverticulitis. Lately, I'm noticing that there's sort of dry powder that's coming out from my skin. Yep, don't I know it? It's a very little amount, but I try to squeeze it out, Phyllis, and it discolors my skin. Phyllis, all right, nobody seems to know what it is. Can you tell me what it is? Yes, Phyllis, I can tell you what this is. So what you're describing, if I'm reading you correctly, is chalky skin or ashy skin. Now, these are basically variations of the same thing. This is dry skin, and people develop it on their arms over the course of their lifetime, sometimes earlier on in their childhood, and sometimes later on in life as the skin becomes older and drier with age and with sun damage. So flaky skin, ashy skin, or chalky skin are all variations of the same thing. As I said, they're dry skin. That means that the skin does not have enough oils and other elements to keep itself together in its nice, shiny, happy form. And that creates these dry flakes that keep on falling or shedding off the skin. This is a very common phenomenon. Now, what do you do about it? So the reason why I was kind of going on, Phyllis, is to give you a hint as for what is required of you to do, or what is rather not required of you to do, which is not to scrape or abrade or scrub it or try to get it off or to exfoliate it. Those are all very, very harmful practices, and they actually make your dry, chalky, ashy, or sensitive skin worse. The way they do it is they undermine the skin barrier. And with chalky skin, the skin barrier is already compromised, which is a huge problem. So anything that further abrades the skin, further takes away those upper layers and erodes them or weakens them, will make your condition worse, despite the intuitive approach in which people think, well, I have dry, flaky skin. I need to get rid of those dead skin cells. Nothing could be further from the truth. You want to avoid doing that? Your best approach is to use lukewarm water or cool water to wash those areas. Avoid the scrubbing naturally of any kind. Avoid detergents of any kind. A lot of people think their skin's going to catch fire if they avoid using detergents like cleansers or soaps or other cleaning products. And that is actually the opposite. That will make things much harsher on the skin. So lukewarm water, and then moisturize with a great moisturizer, such as an occlusive, specifically white petroleum jelly or other great occlusive moisturizers in small amounts so that they don't overcrowd the skin and don't stain your clothes, your sheets, or other fabric. I hope that answers your question. Thanks so much for submitting. Now, I think that's all about the time we have today. I appreciate your joining me on this show and looking forward to our next episode of Ask the Doc. No appointment needed. I am Dr. Yuval Bibi, signing off. Thanks for joining me. God bless.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.